Hi, my name is Tyler. I'm a student at Colorado Mesa University, and today we are going to be taking you through the procedure of the punch biopsy. So, for starters, who are we going to do punch biopsies on? Primary indications for punch biopsies are going to be patients with pruritic lesions, so itchy lesions, or patients with suspected neoplasm, so suspected melanoma or any other form of neoplasm. So here we're going to be thinking about our ABCDEs of dermatology, and if there's anything concerning there, it may be a good indication for a punch biopsy. So for our contraindications, number one is just going to be any lesion over 8 millimeters in diameter. These punch biopsies are only so big, and 8 millimeters is just about as big as we can go. Anything beyond that, and you're going to need to do an excisional biopsy. Um, Otherwise, you want to take special care with infected regions. That can possibly be a contraindication, but this is going to be case-to-case basis. There are very few absolute contraindications for a punch biopsy. And then from here, we're just going to talk about complications. So there's a few complications that can arise from these procedures. Number one, just being some pain and discomfort. You're going to administer lidocaine prior to the procedure to try to mitigate the pain. Number two is going to be any bleeding, so take special care with your patients who are on anticoagulants and just kind of watch for increased bleeding. Number three is going to be infection. In some patients, it may be proper to start them on antibiotics post procedure, but in most cases, that tends to not be a severe complication. And number four is just going to be scarring. So here we're going to make sure we're following good lines of tension in the procedure and just try to mitigate the future risk of scarring. So that's a little bit about indications, contraindications, and the complications of this procedure. Now I'm going to send it over to Isaac to walk you through the procedure itself and help you know what to expect when you do these procedures in person.
So to begin this procedure, we're going to begin by washing our hands, and then we're going to measure out the length of the lesion, or the diameter of the lesion. So it's 5 millimeters by 5 millimeters. So this indicates that we should be using the 5 millimeter punch biopsy device. All right, so at this point, we will place on our sterile gloves, which is something that we all know how to do at this point. Pull it out. All right, then we will sterilize the lesion with the alcohol swab. All right, then the next step in the procedure is to use a sterile drape or a sterile towel drape. So you want to grab the corner and then shake it out. Well, don't shake it out. But so then at this point, you want to place it over, try to get it the first time. Don't go over it and then drag back, okay? Because otherwise it makes it unsterile anymore. All right, so now that we have that done, the next step in this procedure is to draw up lidocaine with or without epinephrine. All right, so we use an alcohol swab to wipe off the top of the vial, sterilizing it. And then we will grab our 3 milliliter syringe, and we'll grab our 21 gauge blunt needle. Place it on. We'll draw back 3 milliliters. 3 milliliters of air, and then we'll place it into the vial. And then we will push out that air, and we will draw back 3 milliliters of the lidocaine with epinephrine. All right, so now that we have this, we will shake out all the bubbles that may be in there, and then we'll recap our blunt needle. Remove it, and then we'll place on our 30 gauge injecting needle. So at this point, you want to inform the patient that they may experience pain with the injection, but that you're nerve blocking the area with lidocaine with epi. And so as you're doing this, you want to go in and you want to try to go into the other side of the lesion. And then as you're doing that and you're coming back, you're going to pull back and you're going to continue to inject the medication as Professor Ousley encourages us to do, just to get a greater area of the anesthetic. And as you pull back, you're going to change directions and go into the opposite way. Then pull back, change directions, inject, and then remove it. So with bevel up, try to get into the subcutaneous tissue. Then as you're pulling back, continue to inject, change directions, continue to inject, change directions, continue to inject. All right. So now pull it out and we'll recap our needle. All right. We'll remove that and we'll throw that in the sharps container along with our bullet needle. All right, so now that we've injected the anesthetic into the subcutaneous tissue, the next is to take our punch biopsy device, which we've already selected, and we chose to do the 5 millimeter. So now inform the patient that they might feel slight discomfort, although they shouldn't because they've already received the anesthetic. But the key to this is coming at a downward motion, and you're going to rotate as you're going down. You're trying to get into the subcutaneous tissue. You try to aim for the center of the lesion as you're doing this. And as you're doing this, you want to place your hands in a perpendicular fashion to hold the skin tight. All right. All right. So next step is you're gonna grab your tweezers and you're gonna grab your scissors, and you're gonna be careful when you're removing the biopsy, and be sure not to compress it. And then as you're removing the biopsy, you want to also be snipping away the subcutaneous tissue. Okay. So we're pulling it out and we're snipping away the subcutaneous tissue. Now that you have your biopsy, you'll then place it into the container. You'll label it and then you'll ship it off for histology. You'll inform the patient at this point that it may take a few weeks to get back, but you'll contact them with the results. And throughout this procedure, if at any point the patient is bleeding or anything, any drainage is coming from the site, you have a 4x4 gauze and just take care of it as needed. So the next step in this is we're going to suture the biopsy site. So the general rule of thumb is that however wide the diameter was, you're going to do half that for the number of sutures. So ours was 5, and so technically, I mean, it's 2.5, but we'll put 3 sutures in. All right. So now at this point, the next step is to place an antibiotic ointment on the area with this Q-tip. And then you'll place a bandage on it. And then Emily will give you the follow-up instructions.
So the first thing that you're going to need to do after you perform the procedure is send the tissue off to pathology immediately. And you need to provide pathology the appropriate information such as the patient's name, date of birth, and any other pertinent information about that tissue sample. The next thing you want to do is provide the patient with written instructions on what they need to do the following days. And it's really important that you give them written instructions and not just verbal, because they may forget over the course of the next couple days. So what you need to remind them of is that they need to keep the area where the punch biopsy occurred clean and dry for the next 24 hours. After 24 hours, they are allowed to remove the bandage and then just clean that area with soap and water. If needed, they can place a new adhesive bandage over the site and also use antibiotic ointments to go over the biopsy site. However, after 24 hours, there usually is no need for another bandage. It should be healed up enough where you won't need that. The next thing you need to instruct them on is that they should not be lifting or placing any tension at the site of the biopsy. So don't be pulling at it, don't pull at the sutures, and don't pull at the skin to cause tension on that area and possibly have the sutures rip out. And then the next thing that you're going to need to do is when you do get the results from pathology back, you need to contact the patient immediately and then give them the results of that pathological specimen. And then finally, depending on where the punch biopsy was located and where the stitches were placed, you will need to remove the stitches after a few days. It will just kind of depend on how the wound looks, and if it looks healed enough to have those stitches removed, then you can remove them at that time.